Can chiropractic adjustments cure back pain? Whether caused by poor posture, injury, or chronic conditions, many seek relief through various treatments. Chiropractic care is one such option that has gained popularity. Understanding chiropractic adjustments. Chiropractic care is a healthcare approach focused on diagnosing and treating musculoskeletal issues, particularly those related to the spine. Chiropractors use hands-on spinal manipulation and other alternative treatments to align the body's musculoskeletal structure. Can chiropractic care cure back pain? The effectiveness of chiropractic adjustments varies depending on the cause and severity of back pain. Here are some key considerations: acute versus chronic pain. Chiropractic care is often more effective for acute back pain, such as pain resulting from a sudden injury or strain. Many people report significant relief after a few sessions. However, for chronic conditions like degenerative disc disease or arthritis, underlying causes, back pain can result from multiple factors, including herniated discs, muscle strain, nerve compression, or structural abnormalities. Chiropractic care primarily targets spinal misalignment, which may not be the root cause in all cases. In some instances, additional medical treatment, physical therapy, scientific evidence. Several studies suggest that chiropractic adjustments can be effective in reducing lower back pain and improving function. However, research also indicates that results vary among individuals. Some people will experience immediate and lasting relief. Benefits of chiropractic care. While chiropractic adjustments may not cure all cases of back pain, they offer several benefits. Pain relief. Many patients report reduced pain and improved mobility after chiropractic sessions. Non-invasive treatment. Chiropractic care does not require surgery or medication, making it the natural alternative for pain management. Improved posture. Regular adjustments can help correct poor posture, which is a common contributor to back pain. Enhanced mobility. Spinal adjustments can increase flexibility and movement, helping individuals return to daily activities. Potential risks and limitations. Chiropractic care is generally safe when performed by a licensed professional. However, certain risks exist, including soreness or discomfort. Some individuals may experience mild soreness after an adjustment, similar to post-exercise soreness. Not suitable for all conditions. Conditions like severe osteoporosis, spinal fractures, or infections may require different medical approaches. Temporary relief. Some people may find that adjustments provide only short-term relief, requiring ongoing care. Complementary approaches. For lasting relief from back pain, a holistic approach is often recommended. This may include exercise and stretching. Strengthening core muscles and maintaining flexibility can reduce strain on the spine. Proper ergonomics. Adjusting workplace setups and maintaining good posture can prevent